Hello, my name is Emil Tanghetti. It is my great pleasure to present clinical data on a new high-powered 1927 thulium laser MD Ultra made by Lutronic. And again, it's an ideal device for today's busy aesthetic practices. Now, my view on the aesthetic market is based upon a lot that I actually learned in Korea. Uh, I learned from you that low downtime procedures done over multiple sessions do provide a significant improvement, but without the significant interruption of one's life or the side effects that can occur. So the idea is let's do a number of procedures over a period of time rather than trying to do one risky procedure with days of downtime. Now, what we've also learned is that when we combine therapies, we often enhance our results, and a lot of this has to do with epidermal wounding. Epidermal wounding is a very important part of rejuvenation. There's a number of cytokines and chemokines that get released from epidermal cells when they're wounded that stimulate fibroblasts to make new collagen and elastic tissue. So we'll deal with this in this talk. Now, when we look at the acute injuries differences across the spectrum, we could say the gold standard was full field ablated CO2. The problem with that is huge downtime and huge risk. We've had the fractional non-ablative deeper, such as 1550, 1540, but again, downtime and difficulty doing. We've also had the fractional ablative, again, big downtime. We learned from the picosecond devices that we can create an epidermal injury, get rejuvenation. I think that when we look at thulium 1927, it's just right because it's a little bit of epidermal wounding and also dermal wounding as well. So again, almost the perfect injury. Now, when we look at thulium, thulium is again 1927. It's slightly off peak absorption of water, less than CO2 and erbium, but again, enough to wound the epidermis and also wound the superficial part of the dermis. So again, it leaves a bit of that damaged epidermis there to enhance the healing time and also to make it a much more tolerable experience. Now, the Ultra is a very unique device. It's at 20 watts. It's the most powerful thulium laser available today. And again, it almost has twice the power of some other systems. It has two spots that I very much like using, the 200 micron and the 350 micron spots. And again, we'll talk a little bit about the beam profile. It has a great scanning device that we'll talk to you about. It's a roller style scanner. It has an easy graphic interface. And also, which I learned from you in Korea, is it's nice having low operating costs with low cost disposables. The beam. The original beams were Gaussian, which again left a hot spot in the center, and that leads to a different kind of wounding and more side effects. The new beam profile with the LaserMD Ultra is a new flat top beam. Again, it gives uniform distribution across the field, and again, it gives a nice injury response, as we'll see with the histologies. Histologies are also important, and they basically are the fundamental guide to what we do. We can see here on the left with the 200 micron tip at 10 millijoules, we have an epidermal wounding, a little bit of dermal wounding, and a little bit of interface reaction at the DE junction. As you increase to 15 millijoules, again, you cause a little bit more dehydration in the epidermis and increase the depth of wounding. But again, not a big downtime wounding, something at about an order of 150 to 200 microns. With the 350 micron tip, it's bigger. We have a uniform damage across the epidermis and also the dermis. And as you increase the power to 50 millijoules, you get a little bit more epidermal damage. Now, when we also look at this at the 20 millijoules, we can just see that we again increase a little bit of the depth of the wounding and a little deeper with the 200 micron tip. The 350 again is flat across that whole surface and gives us a nice but superficial wounding that's great for rejuvenation and also great for low downtime. Now, what happens after we do that? Well, immediately we get a wound. The men's zones heal, and over a period of 2 to 3 weeks is exfoliated. We also get remodeling of the dermal collagen over a period of a month or two. and then new collagen that could take up to 3 months to occur. So again, this is a process that occurs over time. Now, what else is special about the Ultra? And I think that, the best thing about it is with all this power, it could give us much more rapid treatments than we're seeing with the older unit. The other thing is it gives us a nice predictable effect. I like the 200 micron spot for scanning. It is absolutely terrific. And again, I think the operation is intelligent, as I'll show you with the scanner. It really takes a lot of the guessing out of this. When you stop moving, it stops firing. If you move faster, it fires a little faster. So it kind of adapts to us rather than we adapting to it. So again, fast treatments, and that's all about power. The older unit had a 100 micron tip. Again, very small. I think the 200 micron tip is absolutely perfect when you're scanning. When you're stamping, I like the 350 micron tip. But again, this leads to a much more rapid treatment, and I think a much more effective treatment as well. Again, I like looking at this scanner. It shows its pattern there. You can do the conventional or the random, which I like the best. Alternatively, you can also stamp as well. So again, a lot of versatility. It adapts to us. We don't adapt to it. Now, I like showing you a treatment here, and I think the treatment's also useful, showing you what it looks like in real-time action. So again, it's moving, it's shooting. As it's going, you don't see the patient wincing. You don't really need much anesthetic. You could use topical, but again, you could do it without. You go one way, then go the other way for a second pass. You can see this goes very rapidly, going quickly. You can do a full face in a matter of 10 to 15 minutes. And again, with minimal discomfort, you feel a little stingy sensation, but it really isn't that bad. So again, versatility in the way that it's distributed and given. Now, we did a multi-center trial. It was done with our center and also with the center in Massachusetts. We treated the face, the décolleté, up to 4 treatments, 4 to 6 weeks apart. We used the 200 micron tip and the 350 micron tip to stamp for spot treatments. And we looked at people before, after treatments, and for follow-up visits. And again, these were graded by blinded graders with a look at the pigment and also the global aesthetic improvement in pigment as well as photo damage. When we look at some of the clinical trial results for the Ultra, we can see that as we're going with the treatments, percentage coverage, we were initially started around 20 and then we went up to closer to 30%. Again, no problems with downtime. Our initial treatments were done around 12 to 13 millijoules, and then after a while we became comfortable, we were more like 15 to 20. And when we're looking at the average discomfort with this, it was something that was very well tolerated. 81% of patients did not receive any topical anesthetics. And the number of passes was typically 5 to 6 passes during our treatments. It was erythema lasting 1 to 2 days. And again, it was an overall very nice experience during this treatment. When we look at our results, and we especially look at pigment, and again, these were people from the US where pigment was a big deal with photo damage. I know you in Korea have more pigment due to a lot of other causes, but usually it isn't photo damage. Your patients there do much better with that than we do in the US. But you could see here that the pigment is improved, and the blinded graders agreed virtually all the time and were able to recognize the before and after images because the results were very obvious. When we start to look at the GAIS scale for changes in pigment, we can see here, if we look at the graders, there was consistency. Everyone was improved, most were much improved. So again, this left a very nice feeling that everybody got better on treatments. So when we looked at the grading, and it was pretty obvious that one treatment got us a little improvement, but it took 2 to 3 to 4 to get us to that point of having more people to very much improved. And again, I think this is something you do in Korea. You do multiple treatment sessions with low downtime, and you get to that point. And I must say, we've learned a lot from you in Korea on how to do this. You've taught us a great deal about this, and I really respect what I've learned from you on my visits to Korea. So again, when we looked at randomized expert grading of photo damage, as I said, virtually everyone was improved, and either was improved, much improved, or very much improved. And again, this is with 3 to 4 treatments, so this is pretty substantial. You can look at the patient here. This definitely looks better after a couple of treatments. We can look at this patient. This is after 4 treatments. We can look at pigment. Pigment is very much improved. We can also see the iridids are improved as well, around the eyes and around the mouth. Again, a nice result. This is the other side, again, after 4 treatments, a nice result. You can see the pigment is much improved. You can also see rejuvenation of the skin and certainly some degree of tightening as well. This is that other patient, again, after 4 treatments that we showed earlier. You can see improvement in the pigment and also improvement in the solar elastosis with the crinkling on the cheeks, and also some of the wrinkles around the eyes and a little bit here in the marionette lines. This is someone with melasma. And again, I think this can certainly be done. This is an Asian patient that did well with 3 treatments. And again, I think there's other things that you can use. You can adjunctive measures. And the system also comes with things like tranexamic acid that would help as well. So this allows us to add topicals in addition to this during the treatment and right after, and also on an ongoing basis. This is, again, another patient with photo damage. After 3 treatments, you can see improvement of the pigmentations and tightening, and again, some of the fine lines and wrinkles. Again, a nice result only after 3 treatments. This is another patient after 3 treatments that shows remarkable improvement in pigmentation and also some degree of tightening. When we look at tightening and this degree of improvement, again, I've also had experience with acne scars that show the same kind of improvement where we see tightening, we see collagen remodeling, and we also see improvement of pigmentation. So again, this does translate to other conditions as well. Scars as well. This can also be done on the chest, the décolleté. We can see after 3 treatments improvement, so safe to do off the face. Works great on the face, the neck, and the chest, and other areas as well. There is an opportunity to get even better results by combining the fractional thulium, Lays MD Ultra with RF microneedling, and here with the Genius. This shows a patient immediately after, 1 day, 3 days, and so on. So again, it is still a low downtime procedure, but by combining treatments, we can enhance our results by giving a superficial as well as a deep injury for rejuvenation. This is for rejuvenation with photo damage, but you could also do it with acne scars and get good results as well. Show you is a particularly good example of this. This is really after 1 treatment, 3 months after 1 treatment, using the Genius and the Lays MD together. Again, a very nice substantial result. So I usually get mine in 3 to 4, but this is just 1. So again, this shows you the utility of combining procedures, RF microneedling, the Genius with the Lays MD. Now, I think when we look at hair regrowth, that's a very interesting thing because, you know, when you damage and wound the skin, you release a vast number of cytokines and chemokines, growth factors that do make things rejuvenate and grow. And so the idea is, can you do it in hair? And I think you in Korea have very convincingly showed that this does work. The other thing that also happens, as we said earlier, is with Lays MD or the MD Ultra, you can actually increase the topical, absorption of things that you put on the surface of the skin. So again, this is something that is utilized with the Lays MD Ultra. And again, I think whether it's tranexamic acid or some of the other growth factors that you could put for hair restoration, this is a very positive thing. This is the Keralace hair regrowth system with Lays MD and also the factors. We can see improvement before and after. And again, more hair. This is pretty convincing. These are other before and after photos that were done in Asia. We can see before and after, 12 treatments after 1 week, 12 treatments in 16 and 3 months, and so on. So So again, you can see a very convincing improvement over time with this device. Now, this Carolase system has a number of growth factors that get deposited there. You can certainly do PRP, but PRP is difficult. You've got to, there's room for error when you got to pull the blood off. You got to centrifuge it. I kind of like this system better, and it's very easy to combine with the LazyMD Ultra. So again, I think that's something to look into if hair restoration is part of your clinical practice. Again, I'd like to stress the intelligent operation of this device. The magnetic roller tracker system with the handpiece is absolutely terrific. When you go faster, it goes quicker. If you slow down, it goes slower, so you don't have to worry about under or over treating an area. If you're going too fast, it'll alert you. I like the random dispersion mode so that you don't see a gridded pattern when you're done when they're healing with men's zones. It's very nice. It looks very natural. This can be easily hidden with makeup. Again, the handpiece has a speed protector, so if you go too fast, it tells you, slow down a little bit. It also gives you a total energy and coverage rate display on the GUI interface. Again, it's a very sophisticated system that's also very, very reliable. So there are a number of tips that you can use, and it makes this a very easy treatment. I like the roller tip an awful lot. It works really, really well. We also have the larger tip to stamp as well. So again, this makes for a very nice treatment with a lot of options. So I think we get back in conclusions. The LazyMD Ultra is a powerful 1927 laser with state-of-the-art intelligent scanner that permits an accurate, rapidly performed treatments with minimal to no downtime and with really minimal to no anesthetic requirements. Again, I've learned from you in Korea, multiple sessions reliably produce a significant improvement in dyspigmentation. And if you have photo damage, yes, melasma, but also acne scars. I've had some really great results with acne scars. I don't have my pictures yet to show you, but again, I've seen nice improvement. You don't need to necessarily wound deep to see improvement. I think an epidermal wound and a superficial dermal wound is just fine. The thing that I find particularly exciting is it can be combined with other procedures such as RF microneedling at the same time with not much increase in downtime, but with a significant increase in the response that we see. Now, the other thing is Lutronic is an incredible company that delivers devices with reliability and quality that you've come to expect from them. So again, I think we can speak to this in a very cost-effective platform. And again, I think it's something that would be a great addition to a number of practices. Thank you very much for your attention.